All. This is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. So, Novavax has been a discussion, and the recent data has been something that is all of our curiosity. So, let's look at the Novavax trial results. We'll continue this series and then we look at more recent data in the coming days as well. So, let's start. And if I can give one line summary, 90% vaccine efficacy, no thrombosis, no myocarditis, no ADE, no anaphylaxis, at least according to their data. And the study was in US and Mexico. Total about 30,000 people participated in it. Although folks from Mexico were, I think, lesser than 2,000. So that is a summary of it. Let me now go in the detail to discuss this. So this is drbeen.com. There is a link in the description that gives you the premium account for just a very tiny amount, and that is 1,000 videos access, which is premium on drbeen.com. So take advantage of that. This is the study. This was published in February 10, 2022, and that is the study we are going to look at. And as you can tell, there are a tons of links over here. I will go over these after the data just to show you various authorizations and news about Novavax. So let's start with the paper. So this is the paper which I am going to go over. So let's just start with this now. Here is the efficacy. The data that we have here is from December 27th, 2020 till February 18, my birthday, 2021. So tiny 2-3 months time, not even 3 months, 1.5 months, 2 months. 29,949 participants, 19,714 in vaccination group, and 9,868 in the placebo group. It was a 2-to-1 ratio, which is fine. And it included US and Mexico participants. So let me answer the main questions that people have been asking me. That is, what are the side effects? And so we have become actually more concerned about the side effects of these vaccines compared to what are the benefits of them. So according to the data, and I'll show it to you, their document says myocarditis, none, pericarditis, no, thrombosis, no, vasculitis, they did not talk about it, anaphylaxis, no, ADE's evidence, antibody dependent enhancements evidence, no. And they also admit that the data that they have here is for a shorter window of time. What is that? So let's say this is the dose 1 given. Soon after the dose 1, they actually start counting the cases and the side effects after the dose 1. Then there is dose 2, 21 days separate from dose 1. Then they continue to see, normally from 7 days onward from the dose 2. However, they continue to go 28 days after. So that makes it a 49 days time. In some cases, they have data for up to 3 months. So that is what they got. Let me show you this blurb before we continue. My apologies. So here, actually, no episodes of anaphylaxis, no evidence of vaccine-associated enhanced COVID-19 or ADE, no events that triggered pre-specified pause rules. So when you're starting a vaccine trial or any drugs trial, you have a pre-specified pause rules. You say that if this happened, you just pause, stop, don't go any further. So there nothing happened that triggered those rules. No episodes of GB syndrome or Guillain-Barré syndrome. No imbalance in myocarditis or pericarditis. So the myocarditis or pericarditis myocarditis, according to them, were balanced in both. And we look into that. No imbalance or no vaccine induced immune thrombosis with thrombocytopenia were observed during the relatively short safety follow up period reported here. So these tables, S14 and 16, we will see them. But this is what they're saying. This actually is a very different picture compared to the other vaccines. Okay, so continuing, I wanted to put the side effects first. So if you are just interested in what is the efficacy, 90%. One more interesting thing, in Black folks, the efficacy was 100%. This is the first vaccine that has this efficacy in African Americans. And unfortunately, in Latinos and Hispanics, the efficacy was lower than other groups, 63%. And the confidence interval was from 18% to something. So this was as low as even 18% possibility. So it was not really great for Hispanics and Latinos. Now, for the variant that was mostly within this window, that was alpha variant. I believe more than 40% of the sequences that were done for the people who got infected when they were on placebo or vaccine, they more than 40% were alpha. And then they had other as well. And there is a list. Omicron is not part of it. Then they say that at baseline, the 6.3% vaccinated and 6.9% placebo were seropositive or RT-PCR positive. So that is the positivity or the COVID exposure that occurred. They had two types of populations, full analysis population and per protocol efficacy population. The difference between them is full analysis is everybody who participated, 29,000 some. And per protocol population, cohort was those who actually were the ones that went through the whole protocol correctly. For example, people who did not show up for the second dose were excluded. Or I was cracking up on this one, they actually write it in their document that some folks actually suspected that we have not gotten the vaccine because they didn't have the side effects. So they came in and they said, it looks like you gave me a placebo. Can you please unblind me? Or can you tell me that which one did I get? Now, if you tell them which one did they get, then they get out of the trial as well. They cannot continue. So they had to unblind some folks who suspected that, hey, I didn't have side effects. And so they got excluded. So there were a number of people who got excluded. So the final full population analysis showed the following: 21.2 cases per 1,000 person years versus 51.9 cases per 1,000 person years. So almost 3 times, or not 3 times, 2.5 times more in placebo. And if you see the confidence interval, 16.2 cases to 27.7 cases. This, if you take this line as 100, then vaccinated individuals and their risk or their incidence of cases fell in this range, and placebo fell in this range. Definitely, vaccine had a benefit. Now, the per protocol efficacy analysis cohort, the cohort that went through the whole vaccine protocol, and they looked at them till April 19, 2021. It is the number. There were 25,452 out of 29,000 some. 47.3% had one or more comorbidities. So almost half, of course not half, lesser than half, 43%, 47.3% had a comorbidity or more. Median age was 47 years. Only 11.8% were greater than 65 or greater. And the reason they said was that by that time, when they started their trial, there were other vaccines that had been authorized, and so people started taking those vaccines and they were less interested in the trial. 18 plus was the trial population demography. 48.2% were females, 75.9%, 76% were whites, 11% were blacks, 6.2% were Native Americans, Alaskan Americans, and so on. 21.9% were Hispanics and Latinos. So in this group, out of this group, 25,452, 77 cases of infection occurred. Out of these 77 cases, 14 were in vaccinated and 63 were in placebo. 14. Now, please remember, these are absolute numbers. And also remember, vaccine cohort size was double compared to placebo. It was 2-to-1 ratio. So 14 in vaccine is actually 14 out of the double size of the group versus 63, which was half the size of the vaccinated. So the overall efficacy came to be 90.4%. And if you look at the 95% confidence interval, 82.9 to 94.6. So if you had a range of 95% confidence, you would say that the range is, it would have efficacy between 83% to 95%. P-value was 0.001, so that is significant as well. So that is the important part here. Now, moderate to severe cases. There were 14 moderate to severe in placebo, all in placebo. 10 were moderate, 4 were severe. There was 0 moderate and 0 severe on the vaccine side. So for moderate to severe disease, the vaccine efficacy was 100%. I love it. No myocarditis, no thrombocytosis, no pericarditis, no Guillain-Barré syndrome. Although the size is small, but still no Guillain-Barré syndrome. 100% efficacy against moderate to severe. Of course, we do not know about Omicron, and that is what I'll collect the data from the countries where it has been authorized and what is the state over there. All-cause mortality, so that is not COVID mortality, but all-cause other than COVID, or just everything. 9 deaths in the vaccine side, 5 deaths on the placebo side, but also please remember vaccine size cohort was bigger. So 0.5% was the all-cause mortality in both groups, so that was balanced. Now some notes before we look at the tables. This is very important that 100% efficacy in blacks, because other vaccines have not shown that great a vaccine efficacy for African Americans. 67.3% efficacy in Hispanics and Latinos, and the range was from 18% to I think 70 something. So it was not a great range. So this subgroup has to consider other vaccines as well. And we look into that range together. Now, in terms of other side effects, the local side effects, that is, where the injection is, most frequent side effect was the pain on the injection site. It stayed for median 2 days or less, and most after second dose. There was not much other side effects local. Systemic side effects, most common were headache, myalgia, muscle pains, fatigue, malaise, although my cartoon here is standing without any fatigue or malaise, but fatigue and malaise. And fever, this is very interesting. Fever was in lesser than 1% of the people. So fever was a rare occurrence. This is very interesting for me to see. And again, most of the systemic effects were after the second dose. I believe that the systemic side effects were 11.2% after second dose, or were in 11.2% of the people after the second dose versus 1 or 2% after the second dose in placebo. Oh, sorry, first dose. So majority after the second dose. And now we're going to look at the severe cases, which really, from a data point of view, were not there in case of the vaccinated people. Placebo had. So let's look at some of the tables and figures. So first, let's go over the figure 3 and 4. So this is a very important figure. And this, I think everyone should look at it. This is, you can download the PDF of the trial. How do you download the PDF? If you go here, this place on the side here, it says PDF, so you can download that. Then at the bottom is the supplementary tables. So if you go down to the bottom of this document, you would see supplementary tables. So here you can download the supplementary as well. I have them both here. So this is in the main manuscript, figure number 3, vaccine efficacy in specific subgroups. And this is what I want to kind of put that in front of us. Look at this. Do you see this big line here that goes almost from 18% to 80 something? This is Hispanic and Latinos. So their range is from 18.7 to 86.8. You can see it over here. The 67.3% is the efficacy, but confidence interval is really large. And if you see over here, vaccinated people, number of events, so 8 out of 3,733 Hispanic and Latinos had the events, the, let's say, COVID cases, and versus 11 out of 1,751 placebos. So 0.2% versus 0.6%, but this was the least of the efficacy out of all the subgroups. Then look at this black. So blacks had 0 COVID out of 1,893 individuals versus placebo about 1,000, so 900. And there were 7 cases. So that is very interesting, 100% efficacy. So this is a good vaccine for African Americans. So this is one that I wanted to show. Then the second table or figure is the figure 4. This figure shows various side effects and their intensities. So if you see here, local tenderness, pain, erythema, swelling. So erythema and swelling is almost non-existent. No redness, no swelling, mostly pain and tenderness. Dose 2, if you see, the pain and tenderness has increased even more, and erythema and swelling is a little bit more. Similarly, if you see the systemic, the most you are going to see is headache, muscle pain, fatigue, malaise after dose 1. And if you see, fever is almost like the least number of events were for fever. Even joint pains were more than fever. And after dose 2, once again, headache was most common, muscle pain, fatigue, malaise, nausea, vomiting, fever. Once again, the rarest event was fever, and then joint pain. So I thought this was very interesting. Now let's look at these tables. So this is the supplementary content, and I'm going to go over some tables, not all. As you can see, they have a lot of data in here. I wanted to go over S14. Here. So this is S14. This is the summary of unsolicited adverse events by system, organ class, and preferred term reported from after start of the first vaccination through 28 days after the second vaccination. So about 49 days from the day of the first vaccination. So it does not do what others had done, other vaccine trials had done. that they started from the second dose onwards. Anyway, so it is from the first vaccination. So check this out. I have actually marked some that are interesting here. So this one is the disorders, reproductive system and breast disorders. In Novavax, greater than 18, so everyone, 55 cases or incidence rate was 2 versus 1.25. That is one. Cardiac disorders, and I'll show you what these disorders are. And interestingly, they actually had uh, pregnancy as a side effect as well. Of course, whatever somebody reported, that they put that there, and it is actually interesting to see that 2 pregnancies in vaccinated individuals, and I think there was 0 pregnancy in placebo side. Cardiac disorders 45 versus 21, so almost balanced. So if you see here, 1.64 versus 1.54. Remember the excuse me, the vaccinated cohort size was double. So balanced. Ear and labyrinth disorder, so that is the tinnitus type disorders, 44 versus 16. So this was actually a little more in the vaccinated side. Immune system disorders, 1.05 versus 0.51. So that was also more on the vaccine side. Neoplasias, cancers, benign, malignant, and unspecified, they were also more on the vaccine side. Renal and urinary disorders, they were also tiny bit more on the vaccine side. These numbers are so small that they cannot provide power to be able to say that this is significant or not. But you can see that here, I'm going to go to the tables as well, but you can see over here that actually there are more incidences for reproductive issues, ear issues, immune disorder, neoplasias, and renal and urinary disorders. Now, the question is, cardiac disorders seem to be balanced. The question is, what are these disorders? So let's look at them. So this is the table S15 that contains further details. So cardiac disorders. Now remember, they were balanced in both. But what were these disorders? Atrial fibrillation. So here, if you just very quickly look at the header, the first one is Novavax vaccine, the first column or 2 columns, greater than 18, and then placebo. So I'm just going to go with that one. So atrial fibrillation, 7 on the vaccinated side versus 3 on the placebo. So 0.13 incidence compared to 0.08. So atrial fibrillation was definitely more on the vaccine side. Myocardial infarction, 4 on the vaccine side, 2 on the placebo side. Vaccine side cohort was double in size, so this actually is equal. Acute left ventricular failure, 3 on the vaccine side and 0 on the placebo side. So this was actually more on this side. Now, they have not declared if these were caused by the vaccine, but these were in this cohort. Cardiac arrest were equal. Cardiac failure, congestive, 3 versus 1. So mildly about one more person. Now, I wanted to tell you a story as well. You can see here cardiac failure, congestive, or you could call it congestive cardiac failure. They put that over here, I think, for the to have the cardiac failure come first. The story is that one of the auditors said to me that you use the term congestive cardiac failure in your teaching, and that is an outdated term. Nobody uses that now, so you should not use it. And because you used it, we want to cancel you. And here is a vaccine report card that is given to FDA, and FDA is going to look at this and make a response and decide to authorize or not. And you would see in the news the same report card or trial result went to Europe and Canada and New Zealand and India and Australia, and they use this to approve or not approve or authorize or not. So this is a term that is used. You're seeing it over here. So that tells you that when somebody is trying to cancel you because you talked about ivermectin, they would do everything to sidestep the basic discussion and just find some excuse to cancel you. So that was funny for me. Okay, so acute myocardial infarction, 2 and 2. So basically acute myocardial infarction was lesser. Again, these numbers are so small that we cannot really say which side. So we'll have to, overall, you saw that the cardiac issues were balanced. And then the other one are tiny numbers. I'm going to continue. So here, nervous system disorders. So of course, I was curious about Guillain-Barré syndrome and hemisection and the bells. So look at this: cerebrovascular accidents, CVAs, 7 on the vaccine side, 1 on the other side. And so 0.13 versus 0.04, this is not balanced. This is actually more on the vaccine side. So it would be interesting to see what was the cause of it. Ischemic stroke, 2 on the vaccine, 0 on the other side. Central, excuse me, central nervous system inflammation, 1 on the vaccine and 0 on the other side. Again, the numbers are so small that they're not powerful, or they cannot reach the power, but still. Peroneal nerve palsy. So peroneal nerve palsy is at the injection site. 1. So that to me seems like a injury because of the injection. And then other things which were actually more on the placebo side. GIT, intestinal obstruction, 2 cases. I cannot imagine why would vaccine cause intestinal obstruction. So this is just, they reported it. Pancreatitis, that was interesting, 1 case on the vaccine side. Respiratory and thoracic issues, acute respiratory failure, the respiration just failed. 3 cases on the vaccine side, 0 on the placebo side. So that is also kind of imbalanced. Aspiration pneumonia. So somebody would have vomit, and the content would actually, instead of going out of the body, would go in the lungs, or some part of the content will go in the lung. So that is called aspiration, and that causes pneumonia or infection in the lung. And plus, the acids coming from the stomach, when they go in the lung and the airways, they really cause a lot of burning and inflammation. They can cause asthma, they can cause infections. It's not a good thing. So 3 cases on the vaccine side. Pulmonary embolism, 3 versus 2. So vaccine side actually had lesser than placebo. Cancers, prostate cancer, 6 on the vaccine side and 0 on the placebo. This is interesting for me because to think that vaccine will cause prostate cancer within 20-30 days is really not, and I don't think it is possible. But anyways, that is the imbalance you're seeing here. 0.11 incidence here compared to 0. Breast cancers, 2 versus 0. Vascular disorder. So I was curious about the thrombosis. So deep vein thrombosis, 2 on the vaccine side, 0 on the other side. Then liver, cholecystitis, acute, so the gallbladder and the inflammations there, 5 on the vaccine side and 0 on the other side. So that is interesting as well. Cirrhosis of alcoholic cirrhosis, 1 on the vaccine side and the 0 on the other side. Now again, I don't think vaccine has much to do with that, but that is what was reported. Psychiatric disorders. So if you see here, depression was more common on the vaccine side, and two cases versus 0. Then pregnancy and related conditions: abortion, spontaneous abortion, 3 cases on vaccine and 1 on the placebo, so slightly more, 1 more on the vaccine side. Pregnancy, two pregnancies, I shouldn't say cases of pregnancy, 2 pregnancies on the vaccine side, nothing on the placebo. I don't think vaccine had anything to do with that. And so this is it. These are the, actually there is some more vascular disorders: deep vein thrombosis, 2 cases on in the vaccine side, 0 on the other side. And blood and lymphatic disorders: thrombocytopenia, 1 case on the vaccine side and 0 on the other side. And if you see here, immune system disorder, Guillain-Barré syndrome, 0. So that is a discussion. Somebody said, David says, so is Novavax effective and safe or not? So according to the data that they gave, the summary, according to that, it is effective 90%, and it does not have myocarditis, it does not have pericarditis, it does not has evidence of ADE, it didn't cause any anaphylaxis, it did not cause Guillain-Barré syndrome, and it did not cause thrombosis. So that, in my opinion, it seems like from this data safer than the other vaccines. The thing is, the window of time is short, 3 months. So we have to still know more. So those countries where the vaccine has been, I'm now going to look into the data there. Let me actually very quickly then show you the news as well for the vaccines. So if I go here, so I'm going to quickly just close these tabs. So this is the original one. I'm going to close it. This is Novavax's press release. I have the link in the description. I could not put all the links in the description because YouTube does not allow more than 5,000 in the description letters, characters. So I had to remove some of the links. This is Novavax and Serum Institute of India announces first emergency use authorization of Novavax COVID-19 vaccine in adolescent 12 to 18 in India. So in India, Novavax has gotten approval or authorization even for adolescents. This is New Zealand, authorized there. Then authorized here in the UK. This was Feb 28. Shipments of COVID-19 vaccines to European Union member states. Health Canada, Feb 17, they authorized it. So that is why people say that I have to travel to Canada to get Novavax. Singapore, Health Science Authority issues interim authorization. So Novavax files for conditional marketing authorization for COVID-19 vaccines in Switzerland, Feb 14. In Australia, Feb 10. And then this is the announces positive results. So we just looked at those results. New Zealand's MedSafe grants provisional approval for Novavax. So that is done. Medicine and Healthcare Products Regulatory Agency grant conditional marketing authorization for Novavax in Great Britain. This is Feb 3. Submits request to the US FDA for emergency use authorization. That is January 31. And 2 weeks ago, the news was that it is imminent that they are about to get the approval or authorization. Let's see. Novavax in Israel announces advanced purchase agreements for supply of COVID-19 vaccine. South Korea Ministry of Food and Drug Safety approves Novavax. And then this was Novavax submits final data package for US FDA as a prerequisite for the EUA. That was December 31. So these are the discussions. Thank you very much for being here and listening. There is a link in the description. If you like these talks, there is a link for Drbeen premium videos. And these are more than, I think there are more than 1,000 videos here by many, many doctors, including me, yours truly. But there are many other doctors and professors whose lectures are here as well. And if you look at that link and you look at that price, it's not even 2 lunches. It's not even 1/4 a day. And it's one-time payment. So it is free at this time. So take advantage of that and have fun. Now, if I can request an off today from the chit chat, I have a phone call to make for a business discussion. All good, no bad discussions. So if you allow me a day off today from the chit chat, I'll be really grateful. So let me just see if there is any. Alexander says premium videos are used to pay for Luffy Catio. Yes, absolutely. Um, John says, was the Novavax vaccine developed or tested using embryonic stem cells? So I believe that Novavax is all without the embryonic stem cells. It has been made with the. I did a video where I went over the whole structure of how they developed it. So other cells, not embryonic stem cells. So I was thinking about that. Critical thought said you can't travel to Canada unless you're vaccinated. Yeah. So you have to kind of swim through various ravines to end up in Canada. So that is correct. Carlos says the imbalance for cerebrovascular accidents is a concern. Absolutely. Because that was a lot more on the vaccine side. David says, so it's a rock star so far? Yes. In my opinion, compared to the other ones, it seems to be better. But as you saw, there are some areas of concern, and I wanted to put them in front of us. Paul Borg says, also the numbers are small, but looking for unexpected harms is the reason such trials are done. That is also one important thing. And none of those um, events got triggered, which can take into account the unexpected harm and even stop the trial. So that didn't happen, or pause the trial. That didn't happen. You might remember that in some other vaccines, sometimes the trials were paused. Okay, so Guardian Angel says Australia started out of 39,000, one myocarditis, one pulmonary embolism, one thrombocytopenia, 23 chest pain, one ST elevation from Feb 14 to March 10. So that's a lot within a very short period of time. The question is, what was the outcome? I mean, if you extrapolate that 39,000 to billions of doses, you can see it scaling up. What was the outcome of myocarditis and pulmonary embolism and thrombocytopenia? Chest pain means myocarditis was occurring. That chest pain is also an indication of cardiac problem or respiratory problem. And ST elevation is also a myocarditis. So it's not, I don't think it's just one myocarditis, then it's going to be more. So I will look into that. Guardian Angel, if you have any um, link to this, please share. I would look at that link tomorrow as well. So Colombian says, can you discuss the eye disorder? So the eye disorders that I saw here, there was diplopia. So let me go back to that document. So if you see the eye disorders, I believe here. So there was just one, and that is diplopia. Diplopia means seeing double. And there was one case in vaccinated side out of those 19,000 some. One case said, one person said that, hey, I'm seeing double, and then zero on the other side. So that was the eye disorder. Cool. So what else? So John says, Linda, thanks. The answer to that question is very important to me. John, which question? Let's see. Let's see John's question. Augie says the subscriptions can be gifted to others. Yes. You just put their email address and create an account and buy, and that they would have access. It is a protein subunit. So I have done many videos before about the Novavax and its construction, how it is made, what kind of vaccine it is. So I didn't want to just repeat that over here. Cool. So this is a good question. NCDL says, how long after getting Omicron and being unvaccinated should you get vaccine? So if somebody got Omicron and was able to handle it perfectly fine, then I do not know if there's a need for the vaccine. That is just my thought. SK says, can you review the Moderna data for the 6 months olds? Sure, I can do that. Tanya says, excuse my ignorance, does it make spike protein? It is actually a bouquet of spike proteins, pre-made spike proteins made outside of the body and then put together in a nanoparticle and then sent in. It does not have a lipid nanoparticle, so it does not go into the cells. It sits outside the cells, and then immune system cells eat it up and they break it, and then immunity or the training starts. So ZZ Berman says, what are your thoughts on Novavax for long haulers based on new data? So I have to look at the new data. This is not really very new. This is 2021 early. There is no indication here where I can correlate it with long haulers to say it can be useful or not. So I can't really answer this question. I'll research. If John Snyder and Texas Meg are here, I would request them if they have any links. They've seen this, please tell me. So Braun says, Dr. Bean, regarding Australia stats to TGA dyne for numbers. Okay. Alexander says third eye on the forehead. Yes, if you buy the Dr. Bean account, you would develop a third eye through which you can see medical concepts very clearly. Okay. So Anthony says, would Novavax make a good booster? Following mRNA, it is currently allowed as a booster in Australia. Yes, I think it is better than the other guys. Kelly says, I'm sad I cannot see Alquin's emojis. Alquin's makes emojis, yes. Okay, cool. So please do me a favor. There is a link in the description. Use that link and buy Dr. Bean premium account. One-time payment, very low price. I'm becoming a little salesy now. And then there are links as well to buy me a coffee, or if you would like to use PayPal, or if you would like to become a patron. Thank you very much. Today I'm going to skip the chit chat. I'll see you tomorrow. Have a good day. Bye bye.